Right. Well, I think we have a substantial quorum here of those who have registered. A few more people may join, and I'll let them in as they show up in the waiting room. But just to welcome everyone for joining us today for webinar number 2 of AHI's new webinar series. For those of you who don't recognize me or know me, I'm Anya Brickman-Raridan. I'm a principal at AHI. I've been here for 7 years now. And while we've spent a lot of time in the past on Zoom for business-related and client-related matters, we've only recently started thinking about it as a great way to engage our wider AHI family in discussions on things that we're thinking about all the time. So this is webinar number 2, and we're focusing on health secure housing, which is an idea that David has been working on along with some of our colleagues for the last 3 or 4 months intensively, and certainly the ideas were germinating before that, but came into sharp focus, as I'm sure everyone on this call is familiar with, the importance of a safe and secure and enjoyable house when stuck there in the middle of a pandemic. And joining us today, we have also invited John Macomber, who's a senior lecturer at the Harvard Business School and has a background in real estate, construction, and information technology, all elements that tie into this idea of health secure housing. And most recently has published a book, called Healthy Buildings, How Indoor Spaces Drive Performance and Productivity, another concept which we are probably all recently discovering the importance of at a personal level, as well as a professional level. And we're also delighted to have John because he has familiarity with both developed economies and emerging economies, which is a similar range of regions and areas that AHI works with. And so being able to talk with like-minded people who understand both contexts and can take these ideas into both places is very useful and fun for us. So we hope today will be a good discussion. David's going to give an introductory presentation. John will offer some thoughts and response, and then we will open it up for question and answer, but really more of a discussion. So feel free to jump in. You can take yourselves off mute. We should have about a half an hour for that, and I will moderate that as necessary. If you have questions along the way while David and John are speaking, feel free to put them in the chat, and I'll keep track of them and make sure to either call on you in the open session or otherwise bring them forward. David, it's all yours.
Sometimes the way to predict the future is to invent it. And sometimes the way to invent it is to define what you want. A few of you on this call know that before I started in the affordable housing realm, or as I was starting in the affordable housing realm, I was a science fiction writer and got several novels published and even participated in the creation of a shared world future history of Boston, cleverly titled Future Boston. And the reason I'm starting with that, and I will put my screen share going and then get my screen up there. The reason I'm going to start with that is because science fiction turns out to be a very good way to define a future that you're not in control of, but that you're going to participate in the making of. And that's what I'm going to talk about here. The concept of health secure housing in simple terms is once you're home, you're safe. That phrase is an aspirational phrase, but not just an aspirational phrase. It becomes a means by which you define what the new standard will be. And so we set out to do that. We set out to say, well, how do we make housing health secure? 4 months ago, we took for granted that it was not an issue. Now everybody is concerned about the health security of their office, their housing, their multifamily dwelling, and the like. I'm going to do this quick because almost everybody on this call has read some of this material before, but I'm going to get to the highlights to tee up John Macomber, who's been thinking about this in the larger context of healthy buildings. Everyone you live with is now part of your health family, whether you like it or not. And we have a stake in each other's wellness. And I have observed at a personal level that the interplay between people we see regularly for business or commerce and people that we live with is now more personal because the personal has become the professional. over time. That's because wellness of a community is connected to the idea of knowledge, which is connected to trust, and trust is built over time. So there are 5 elements in making housing health secure. There's a medical element. There's a physical element, which I'll talk about some more. There's an operational element. How do we change interactions? And since I'm focusing particularly right now for multifamily owners, how do we think about how employees of the owner and manager interact with residents, and how residents interact with each other, and how they all get trained? How we share information, because literally in a health secure environment, what you don't know can kill you. That's what the testing is about, and the contact tracing and so on. And then there's an economic element. How do we finance all this stuff? I put up there, this is the first of several little graphics that I'm going to illustrate. That's an actual thing. You can buy a box that you can put in an environment which will tell you its indoor air quality, including temperature, humidity, everything else, and report it to your phone and report it in real time. It's a natural thing that you'd potentially add. Well, sorry about this, my animation's a little screwed up. It's going to lead, and has already left, to paradigm shifts. And I'm going to introduce some lingo that most of you have heard before. A social encounter that is wet is one where I risk infecting you or you risk infecting me. And until recently, we thought nothing of having 500 wet encounters in a day, 1,000 wet encounters in a day, if you rode the subway. A dry encounter is one where you can't infect others, they can't infect you, and both of you have a reason to believe that it is dry. That's an important part. The element of belief. I've heard this called in another context health theater, but it has to be more than health theater. And a scrub encounter is one where you get disinfected of anything you might have had. I put up there, sorry about the bad animation, an open air disinfection tunnel that I found in Chile, where a light acid, hypochlorous acid, is sprayed that kills the viruses instantly. Pass through the tunnel, you're clean. It's a good example of a scrub encounter, and it's perceived as a scrub encounter. So we're redefining, as that photograph illustrates, the difference between private space, low socialization space, high socialization space, and public space. In all of these, this graphic is taken from Mass Design, who's one of our teaming partners, but it's a good illustration. You start to think about, and I've only used this one because it's just illustrative, small redesigns of the private and public space. This happens to be going from a corridor to a unit entry. How do we set those up and redefine the ways in which it works? How do we have active monitoring? And how do we, particularly in the Mass Design example, how do we make the people part of the health secure network? Now, to do that, we have to solve a couple of infrastructure gaps. The first one is we have to replace wet commerce with dry commerce. Grocery stores were the front lines for this, but every other form of commerce has historically been a wet encounter. It should be a dry commercial encounter. And that means increasingly that you have to have free-to-user mobile banking and mobile money, because electronic money is a dry financial transaction, whereas paper money is a wet financial transaction. With virtual work, virtual education, virtual socializing, broadband is now not only essential sanity infrastructure, it's essential physical health infrastructure. And that has highlighted the infrastructure gap. And infrastructure gaps arise in part because infrastructure networks are market-driven, and they go to the highest adopters first. Gradually, they become something like a public utility, but there's always not the last mile problem, the poorest mile problem. Infrastructure always gets to the poorest neighborhoods last. And that's in part because it is not purely economic on a private property basis. So installation will end up having to be subsidized or mandated or something like, or something, some combination of both. Because the beauty of these infrastructure networks is that only if everybody in the society is healthy can anybody in the society feel health secure. If you have not read it, reread it, go find and reread The Masque of the Red Death, which is Edgar Allan Poe, 1842. It's only about 2,200 words long, and he made that point way back when. So how do we get there? The chart on the upper right is McKinsey's fancy, you can pay them $100,000, 3 horizons, short-term, intermediate term, and long-term. In the short term, people are trying to defend and expand their current business. In the intermediate term, there's going to be new businesses that emerge. And in the longer term, there's going to be brand new modalities of housing. And I've written about this stuff all over the place. Normalization happens for those of us on the call who may or may not be part of the Hair Club for Men. We have to look at the normalization post-catastrophe in 6 stages. And I've been through this for 45 years. Some of the people on this call have been through this as long as I have. Lead-based paint, asbestos, underground storage tanks, sprinklers, radon, and mold have all normalized in the built multifamily environment in 6 steps. 1, you have to independently inspect and report. And more than likely now, because we're in the broadband era, that's going to mean ongoing real-time monitors. 2, you have to remediate the urgent hazards. 3, you have to encapsulate and isolate the lingering stuff. 4, you retrofit at the next major capital improvement or financing. I'll come back to that later on because there will always be a next major capital improvement or financing. 5, you have to post-certify. We have LEED, green building certifications. We are soon, at some point or another, going to develop out of self-defense healthy building certifications because you're going to need that to tap your favorable financing. I believe, by the way, that all major employers will soon have a chief health officer if they don't already have it. Many of them have something that passes for that. It's become mission critical for employers who are trying to figure out how to get their employees back to work. And I think sooner or later this will translate into a Health Reinvestment Act because this is too much infrastructure at too granular level involving private property. It's going to happen property by property. So here's the business case for those of you who are focused on the finance. If you don't solve health security of housing, rent levels go down, vacancy goes up, concessions go up. We've already seen eviction moratorium and extensions of eviction moratoria. All the eviction moratoria say that, in fact, the rent will still be due, but I believe that sooner or later there will be some kind of holiday or concessionary basis. Some of that will be subsidized and some of that will not. You're going to have new protocols for turnover. We're already seeing this in the hotel motel industry. We're seeing this with people who go on vacation before they enter a public restroom. Everybody's thinking about scrub, prep, inspect, certify. Insurance is already at the stage where if you have an expiring policy, you're going to get something new. Those of you who are not familiar with them should look into captive insurance companies because I suspect they'll be the early adopters. Employers' health insurance and workers' compensation are going to take a whack. Ask the public school teachers and the public school systems. Financing is going to be affected and transactions. The day of reckoning comes when you want to do a transaction. Much of this has been prefigured in my discussant's book, along with Joe Allen of the Harvard Medical School, School of Public Health, pardon me, Healthy Buildings, which is a broad look at all asset classes. I personally believe that housing and affordable housing are the tip of the spear. So, there are 6 questions that I think I'm going to put to this group of people. First to my discussant, our discussant, and then to you all. What procedures are going to need redesign? What changes, and we can be science fiction people here, are on Horizon 1 or Horizon 2 or Horizon 3 of change? Some changes, if you're a property manager, you've done Horizon 1 changes now and you're still doing them. If you're putting a new property in for development, you're in Horizon 2 already. And if you're thinking about a new business line or to diversify your real estate platform, that's Horizon 3. What ecosystem changes are going to be inevitable in the legal environment, the regulatory environment, the litigation environment? Litigation is already looming on the horizon. What preventive measures are going to create the safe harbor that are going to prevent industries from disappearing entirely? The universities in particular are dealing with this whole thing right now. They're the tip of the spear on litigation, insurance, and preventive measures. Repricing or financial readjustment of asset classes. How do people, stakeholders, policymakers, private companies de-risk amid ecosystem change? What are the new linkages that need to be created? And what are the opportunities for top quartile players? Because disruption always creates them. And then lastly, yes, and don't call me Shirley, what else do we need to know? And how do we need to know it soon? And so with that, I will stop my screen share and turn it over to the co-wise head, the head wiser than mine, John Macomber.
Thanks, David, and thank you for going through this very current review of what's going on in the housing space. I was struck by sort of 3 different concepts, and let me throw them out, and you and I can talk about them a little bit, and then I'm really curious to know what the people on the call think, because there's a lot of knowledge in the room, in the virtual room with us. The first concept is around the avoided cost of future payments or future obligations. So when Joe and I originally wrote well, actually, that's the first one. The second is around governments, do they have any money or not? And the third is around who actually guarantees these things. So let me come back to the first one. When Joe and I wrote the Healthy Buildings book, we were looking at the avoided future cost just of outcomes like low productivity and people not quite doing their best. And we did some cognitive work around how cognitive function is impaired if you have extra CO2 in the space. Well, now in post-COVID time, you're talking not just about a couple days out with the sniffles, you're talking about 40 days on a ventilator. That's really expensive. And those costs can't be avoided, whether it's paid by a captive employer kind of company, whether it's paid by somebody who self-insures, like a college or the military, whether it's paid by a health insurance company, or whether it's paid by a city. So you take the example of New York and Queens and Brooklyn, where so many people were so ill, city paid for that when they could have avoided a lot of this, arguably, by fixing the ventilation, fixing the elevators, and not having people ride the really dirty subways. So the avoided cost is a much bigger number than ever was in people's minds before. That's really different, and it's not going to disappear from people's minds soon. So there should be an investing opportunity around avoided cost of future really severe healthcare costs. The second piece that goes with that is around the idea that really no governments have any money. And I'm looking at the arguments in Washington now about another $1 trillion or $2 trillion, but basically that's all borrowed. And yet, the paradox is there's 10s, 20s, 30s, trillions of dollars with a T in the global financial system of private capital earning no yield in insurance companies, pension funds, endowments, sovereign wealth funds. So the paradox is, why can't we get those funds into some of these bankable projects? And part of the idea around that, I think, would be to pay some of those investors for success, to pay them saying, did you actually have results in some of these healthier buildings? And so it's kind of a question of matching up the spending needs that you've identified with what's the return on investment. And the problem classically has been that one party spends, the other party benefits, and how do we make this system work? I think that given how much capital there is in the world, none of it in the hands of governments, and how severe the downside healthcare costs are, this may be a real point of inflection around that. I have some thoughts about how to measure that and how to guarantee it, but you may want to respond just to those 2 thoughts first, and then we'll come back to who guarantees this second.
Well, I'll do my quickie on it, and then you can pose another one, and we can widen the discussion. Avoided cost. I wrote a long time ago that financial catastrophe is a precondition to fundamental reform. Nobody pays for avoided costs until they experience catastrophic cost, and then they start paying for avoiding repetition of those costs. Employers, until recently, treated housing as an externality that they didn't have to care about. Their employees lived somewhere. Getting to work was the employee's problem. Now, employers are faced with the reality that they can't coax their employees back to work. And we're seeing this in the sports arena, where people are paid millions of dollars to play a game, are deciding to opt out of the millions of dollars because they have anxiety. Likewise, we are seeing that people are retrofitting the home environment to put, let's say, air conditioning into a room in the house, because if I'm trying to work there all day, I need the AC because I'm just not as productive. So we have an awareness at the level of employers that they need to think about avoiding cost across workers' comp and across the avoidance of cost. Again, I'm in the residential arena of lost revenue from hotels, office buildings, housing of any kind. As to source of money, I mean, there's a couple parts. First of all, in the short run, the government is the, and I'll come to guarantee. In the short run, the government prints it. In the intermediate run, asset prices collapse in some subcategories of assets to reach the point where somebody can conceive a combination of capital reinvestment to reposition, repurpose, or health secure, harden the environment, and then produce the new type, the paradigm 3 type, horizon 3 typology that produces a risk-adjusted market rate of return. So, and if the government pulls off the stimulus trick right, then that asset repositioning and price clearance happens fast enough so that inflation does not go bonkers. But if inflation goes bonkers, that's the ultimate thing where the next generations take revenge on us boomers for screwing things up by devaluing the value of our fixed rate securities and fixed income pensions. And then finally, who guarantees it? There's two really parts to the answer. The first part is that you talked about pay for success. Equity is a capital form that is entirely dependent on pay for success. If you can't construct a pay for success or social impact bond model, sooner or later you price the assets cheap enough so that equity goes in and takes its chances. It's the old adage that the third owner always makes money on a speculative asset class. Okay, because the first owner goes bust, the second owner buys before the bottom, and the third owner cleans up from the guy who bought too soon. It's some combination of that, and then we put in some, and the other part about it is government will have to intermediate with certain kinds of non-commercial early stage risk. So I will stop there because that was a long answer.
So I think there's two parts to that answer. Yeah, I'm a finance professor at Harvard Business School, so I'm not going to get engaged in modern monetary theory and talking about the government printing the money. But the asset price collapse is real. And I think there's going to be a lot of emphasis, even more than, you know, how many people are in the elevator and how many plastic sneeze guards do we have in the buffet line. There'll be a lot more emphasis on vacancy. And that will mean that any tenant or tenant company or tenant individual who can pay the rent is going to be in the driver's seat. And therefore, they'll ask for a healthy building. So all else equal, they're going to want to say, this building's healthier than another. And you see that response already. I don't know how many emails I get every day from Delta, United, and American telling me how clean their planes are, or from various retailers, the ones that are still operating, telling me how clean they are, or various hotels. And as you listen to the big apartment REITs talk, they have an advantage if you're Vornado or Equity or Avalon Bay or Boston Properties, because they don't have a lot of leverage. They have a lot of capital, and they have a lot of ability within their overhead structure to do research on exactly where the benefit is and showing people their buildings are healthier. This was a real drawback for mom and pop landlords. So mom and pop landlords are getting whacked twice. Partly they're getting whacked because they're not collecting rent. And second, they're getting whacked because they're not going to be able to fancy up their buildings and make them healthier. So I'd be really interested in what the people on the call have to say about that, because the people on the call are in the market. You know, you and I are not in the market every day. So let me throw that out and people can start putting that in the chat box. The other thing I wanted to mention was around the who guarantees or who assures you question. And one of those links was to one of my writings was sent out earlier. Right now, nobody guarantees that your building is safe or your apartment is safe. There's no central health authority who believes the landlord, the bank, the tenant. But there are lots of ways to measure that and give people assurances. And there are 7 S's to this. It's alliterative because that's teacher talk. Around it, around screening, sensors, settings, standards, surveys, statistics, and I'll go through what each of those is and how effective they are. Screening is pretty obvious. You know, do you have a temperature or not? Do you have the antibodies or not? Is it effective or not? I don't know. It hasn't been that effective for the Florida Marlins. Second is around settings. You just talked about settings in your house where you set your air conditioning a little bit colder to be a little more productive. tenants in apartments and in office buildings can say, what's the fresh air set for? What is the fan set for? Do we have MERV 8 or MERV 13 or a HEPA filter in the building? The sensors thing you showed a picture of, this is going to be transformative in my view in the residential space, because 5 years ago, if you want to know how healthy your indoor air was, you had to get a hygienist. They took a big machine, they went off to their lab, they came back, and the results only went to the landlord. Now with that device you have in your hand, that's democratized, and everybody can say, here's here are the conditions in my building, in my public housing in Queens, or in my fancy apartment on Fifth Avenue, and share that with everyone else. So the information is out there and could transform the knowledge of housing buyers the way that Morningstar transformed mutual funds, or Yelp and Kayak and TripAdvisor transformed travel. That's a real democratization of power around those sensors. Standards,
and that genie is out of the bottle. That is not
totally
coming
out of the
back.
bottle, not coming back. That's right. So that genie and the work from away genie and the ability to have conferences like this on
and
Zoom
I respectfully suggest the redefinition of the power relationship between employer and employee. It's being fought out on a number of fronts right now that are visible in the media, but just generally speaking, both staying at home and worrying about your family, and employers discovering that employees will be more productive if they're happier and not commuting on a bus and then a subway and then, you know, a crowded street.
Well, maybe, but I was on a conference with a guy from the Bank of America a week ago, and he said, you know, basically, I'm subsidizing Brian Moynihan, the CEO of Bank of America. He's supposed to buy me an office. Now I'm sitting here taking up space in my kitchen table, or I'm going to need a bigger apartment on my nickel to do this. So that power relationship changes, as does the one for the essential employers. And I think there'll be a lot more well-deserved power for nurses and transit workers and people like that who are very exposed. To finish out the thought here, there also aren't really standards yet for buildings, and actually landlords and schools are putting the standards out on their own, and the lack in the United States of any consistent standard around what else to happen in these spaces. And then you end up with ideas of surveys and statistics. So you've probably seen that MIT and Harvard are going to be surveying every student on an app every day. How do you feel? Did your colleagues sneeze on you? Were you able to get sleep? Are people wearing their masks properly? And ultimately, the statistics will show how many sick days, whether it's from COVID or something else. So all of those measures help good companies or landlords or individuals to be comfortable that the space is safe. They also provide safe harbor. So if you're talking about lawsuits, liability is one thing, negligence is another. Usually negligence is a safe harbor, best practices, reasonable person kind of thing. And the last is around pay for results. So you can show in these health performance indicators around survey settings, sensors, screening, standards, statistics, and the other one that I forgot, settings, that the space is better and the people are performing better. And then that should be able to attract capital at risk. And in theory, capital to help improve the living conditions of the buildings that have both the mix of tenancy and physical condition and ownership to attract that. So we may be throwing enough bombs out here to people. I'd be really curious to know how people react, or how you react to the idea of the.
I have one sentence, and then I'll give it to Anya. The Clue Train Manifesto: markets are places where people tell the truth to each other by their actions and their economic transactions. Whether it's going back to work, where you work, the redefined relationship with employers, we have a boatload of market data that's creating people's tolerance for all of that, and changing the way in which existing power relationships work. Anya, I'll bet there's questions in the chat. And if there aren't, I'll bet you can create some.
There actually are not, so pipe up. And for those of you who don't have your video on, feel free to join us with video. I will also say I neglected at the beginning to mention that we are recording this. We will distribute the recording to all of you, and you are welcome to share it as well. If anyone does not want to be as part of the recording, let us know and we can snip out this later discussion part. But just let us know. You can email me or Noah or David, and we'll take care of that.
And while you're thinking about that, think about the bottom-up generational transfer. There's a generation of people who've grown up, they've always had an app in their hand. They've always had a smartphone in their hand. They've always had instantaneous broadband. They've always had an app. They're used to sharing a lot of stuff. That I believe they will be the early adopters of some of this other kind of stuff. And John, your point about Harvard's going to survey Harvard and MIT survey every single student every day on a series of things. That's very much a generational bottom-up kind of innovation.
And the students are very willing to accept it. You know, that
much more willing to accept it.
The 60s, we're thinking, I'm not going to tell you that information. I turn off my location thing, you know. But that's a different, it's also not equally distributed. So
right.
I'm working now on a case study about a bank in Mississippi, and many of the kids there don't have smartphones, they don't have Wi-Fi at home. It's really adds to the digital divide, in this case, adds to the health divide. And the
flip side is India, where almost everybody has a mobile phone, and people communicate by SMS. We're working with a micro lender, housing microfinance lender, that communicates with all its clients by SMS, and so.
And that, David, is a good segue to the question that has come in, which is are there examples of other countries that are making a transition to health secure housing? And I will add to that, what are the nuances of that should be considered, either because they are making that transition or not making that transition, for different contexts other than US multifamily affordable?
The only one that I know with any detail is India, that has done several things that I think were really good. The central government put in a payment holiday, a strong-arm payment holiday for loans to lower income households, 3-month payment holiday, pretty much immediately as regulatory guidance. They put out a classification system of red, yellow, and green for neighborhoods and sub-neighborhoods within that, and they update that on a real-time basis, certain kind of proxy. They've done contact tracing with a free app that was the fastest downloaded app in history when it was done 3 months ago. Now, again, some of these are context specific. Most recently, the government of India is wrestling with the speed of reopening versus health, because India is a place where if you don't work, the health consequences of that are really dramatic, really fast. So I would say further, I'm not going to quote Zhou Enlai on the French Revolution, but I'm going to say every nation right now is running its own real-time experiment in what you shut down, how you shut down, and how you reopen. And most American states are running slightly different real-time experiments. We can, journalism is history's zero draft, so we don't necessarily know what's actually going on. But 3, 6, 12 months from now, it will be much clearer. We will learn much faster because of the fact that we've got all this parallel evolution.
David, I think you can also infer that some nations are doing this pretty well. If you think about your second slide about health secure housing, and the elements include physical elements and operational elements. Mm-hmm. So very, very dense cities like Seoul and Tokyo have not had huge outbreaks, or even Hong Kong. It's unlikely that they did physical things right away and put bleach spray in the vestibules or ultraviolet lights in everybody's return, or managed to accomplish physical distancing in a way they haven't been able to do for the last 60 years. It's highly likely they did operational controls around where you're going, who you're going with, show us your cell phone to see where you've been, do contact tracing, and a number of extremely intrusive things that it's thought that a Western audience might not take to as well. So I don't have direct knowledge of that, but it certainly would appear from the evidence that there's been a lot of operational work around health secure housing in those very big Asian cities that have had small outbreaks.
That's a great point. And Shannon, you wanted to say something.
Yes, I'm hoping that this isn't out of place. I'm Shannon Ledbetter, and amongst other things, I am a priest, as well as the founder of what was Liverpool Habitat for Humanity, but now is housing people, building communities. And we've just completed what is relatively small for American scope, but we've finished We've completed 32 new build houses, and we've done something unusual. We've taken a historic building, a church, and converted that into 11 three-story townhouses, as well as some additional new build. That was all on land and the church donated by the Roman Catholic Archdiocese. And they have now, we're about to embark on a second church and land. And we're in the process of going through planning permission and getting a plan, and we've got architects on board, etc. And I'm just thinking that I don't know how far along the UK is with this particular these issues, but I'm sure they are looking at them. And we have on our board someone who was part of Liverpool John Moores University and with the School of the Built Environment, and they've done a lot of models working with national bodies to create environmentally friendly homes, technology, adding technology in there. And I'm sure this is going to be really an incredibly important issue that they will want to address. And we've got someone on our board who does that. And I'm just wondering if you all might be interested in a case study of working with us to create, and the School of the Built Environment, Liverpool John Moores University, to work within the UK to put some of these ideas into practice. And we're also working on with the Roman Catholic Church and other faith communities to create a rolling program across the UK for this type of affordable housing, but using historic buildings and new build.
Fascinating. David, do you want to respond to that now? Marty, I also see you have your hand up. We can put.
I'll do a short response, Shannon. This whole thing is a vision that requires evidence and facts and ideas. We have on the call two of our HSH interns, Elizabeth Bigham and Andrea Grimaldi. In addition, Marge Yancey, who's an analyst at AHI, has been doing a lot of work in health secure housing. Thank you, Andrea, for putting your camera on. Always useful. Somebody on ours, and there's Elizabeth, and there's Marge. Somebody on our side will follow up with you to get some insight as to the case that you're working through, because yeah, what you're doing is, I think of as Horizon 2 thinking. You're trying to design a new usage paradigm that also is an adaptive reuse of stranded infrastructure, in this case a church. But imagine if we were able to do that with large shopping malls, which are going to need some reinvention.
Marty, floor is yours.
Thank you. Hi, David. I wonder, in a society with such an incredibly short attention span, how do we sustain this? You know, when if and when the virus goes away, how do we keep people interested? Who's the leader? Where does the leadership come from? And who pushes it on us constantly? Where's the marketing?
I'd make a comment about that. I'm curious what other people think on the call. Maybe we'll get bored with this and forget about it. Like people forgot about 9/11 and they went back to high-rise buildings in New York. They forgot about the global financial crisis and levered back up. My sense is that this has been so damaging that people aren't going to forget, but maybe they will. So Marty, it sounds like you think that people are just going to move on, and 5 years from now, nobody's going to be worried about the next pandemic. Is that your thought?
I don't know if I think it, but I worry about it.
Seems to me that governors, because governors right now are in a competition with other governors to keep employees and businesses in their state and to attract out-of-state employers and businesses. And Americans are an extremely mobile people. So that as the governors either demonstrate successful COVID operational procedures or good statistics, surveys, blah, 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 you're going to see businesses move and people move and jobs move. And as we have adapted to this work from home virtual environment, what the heck does corporate headquarters mean anymore? Manufacturing means something, distribution means something, but where does corporate IP and IT reside? I think the governors are going to be a constant source of competition, and of course braggadocio, but braggadocio helps create competition.
Paul?
Terrific panel. Thanks, guys. Lots to chew on, lots to think about. 2 comments and then kind of a question for discussion. The first one is how sad this conversation makes me feel about inequality in our society and how it's going to exacerbate that. It's John, it's your comments about the Vornados will be able to research this stuff, but the mom and pops are going to fall farther behind in their competition for providing housing and resources. And it's for the poor, it's not just the digital divide, it's home offices are a luxury of the upper middle class or home
and that kind of job, both right? The space in your house and that kind of job.
Yep, and handheld sensors are not going to be widely available or cheap for some time to come.
It can't be a pure private solution for all those reasons, Paul. Agree.
Yeah, no, exactly. So that was my first comment, and I'll get off the soapbox on that. The second one that came early in the conversation that I'm doing a lot of thinking about is we're going to have to, as a society, rethink health privacy laws, right? If you're a landlord letting in tenants, you're now to be health secure, you're going to have to ask.
Well, think about the background checks people already do in affordable housing. Now you're going to have to do health background checks.
That's right. And
you're going to have to. You got no choice.
And we have very strict laws about asking for that and sharing that stuff. So that all has to change.
Yeah. So there's going to be, there's going to be opt-in or opt-out. And the analogy, I don't think we've forgotten 9/11. The analogy is TSA screening, because you can choose not to go through the screener. But if you choose not to go through the screener, you get a pat down. And you can choose not to get on an airplane, but if you want to get on an airplane, you either go through the screener or the pat down. It's going to be that same kind of thing, because you're going to have to, you're gaining admission to a space.
So David, you sound sanguine about being checked out for a highly contagious, brand new infectious disease, which I think all of us kind of understand, but not too long before you get checked for a non-transmissible what do they call diseases that last forever? The high blood pressure or diabetes, or get checked for cancer. The chronic diseases. So.
There is spectacular potential for abuse and surveillance state and discrimination. And again, I'm going to revert just briefly to my science fiction background. First adopters of any technology are the bad guys. Okay. And they have a period of time where they run rampant, whether it's the Barbary pirates or otherwise. It takes longer for the cops to catch up. Somewhere in there, it takes third longer for society as a whole to develop protective norms that balance intrusion versus safety. A guy named Larry Niven, who I've quoted before, one of Niven's laws, freedom times security equals a constant, and it changes in discontinuous steps. We will trade a certain amount of data intrusion for higher health security. Maybe some people will trade more of it and some people will trade less of it, and it will be a big debate in this country. Some country somewhere is going to use it to put a police state in that's going to be the ultimate in Creepsville, okay? But, and I think America, because of our strong background in privacy, is going to be a slow adopter of this stuff. I remember the other one, the one I remember in this, John, is it's the first, 20 years ago, you go to the UK, you can go 10 feet without a camera. That, in every public environment.
We can move beyond this. We could talk about, how the millennials have already given up all that security already, or we could talk about whether it's the government or landlords. Like you could imagine big landlords saying, we're going to do this. We have 80,000 apartments. We're going to make sure that everybody's in them is safe, and that's our rule. We're going to screen you all for COVID every day.
And then
let's move away from that into where does the money come from? Because we sort of ducked that. We said, oh yes, after they finish spending $6 trillion in the U.S. on various
palliatives.
It's palliatives in between, and another couple trillion on public transit or on infrastructure. None of this is going into housing, and yet there's all this dough out there. So, do you think there's the story for how the avoided future costs will lead to private investment just in making buildings healthier. Marty would say no, I think, because he said the story is not going to be, the avoided cost isn't going to be in people's mind for very long. Other people might say yes, and it might be like, okay, it's like a hurricane or a wildfire. It might not happen all the time, but we're going to invest in some resilience. And in the case of healthy buildings, it's not as expensive as floodproofing your building against sea rise. So what do you think, David? Is there another way to attract new kinds of capital or capital in different flavors towards healthier buildings?
The people that we haven't found for domain expertise to add to HSH are the app and tech people. Okay. Airbnb is desperately trying to figure out what they're doing now. They might well be one of the first adopters of certain kinds of health secure housing protocols for Airbnb members and customers. Uber and Lyft are doing the same thing with respect to health security of vehicles and drivers. Somebody like that partnered up with Equity, Avalon Bay, Boston Properties. Now, the challenge here is
the sharing economy before, and you were sharing it in terms of 1,000 people. Yep, that's
yeah. But
the sharing economy and the non-sharing economy.
Right. Affordable housing tends to be a late adopter because we have our Marley's chain of regulations and statutes that we're working on. Part of why we've been driving to National Church Residences, Mercy Housing, Volunteers of America, the big nonprofits. Shannon, in your part of the world, it would be the big housing associations because they already have the IP and IT infrastructure and they have the customer touch. What's going to have to happen on the privacy thing, John? I was trying to pitch this to Volunteers of America. It has to be private platforms that have a high trust component and strong customer relationship based on trust, whether that's faith-based landlords or otherwise, because that's the people to whom you will voluntarily surrender your data because you believe it will be internally protected, will not get stolen by the dark web or slurped up to a government. But sooner or later,
Go ahead.
No, I was just going to say sooner or later, those kinds of bottom-up networks, opt-in kind of things are going to form because they have to.
We've got a few more people who want to jump in. So Dave and then Marty. We've hit a good spot for discussion here.
I was responding to Marty's question of who leads, and I think there have been a lot of analogies made with climate change, and I think we got quickly to cities. John, you cited Tokyo and Seoul as being similar. Maybe it's part of the risk club. So those fellow travelers that we find, the flood club. You've got cities that have more in common with them organized around risk who have been able to pivot those into opportunities. So maybe the leaders are those places that identify the particular typology of housing or the particular level of risk. There's less in common on a national level, but more in common at a city level. Just quick suggestion. Yep,
definitely. And they'll be competing, as David said, and they have really different characteristics around their physical layout and the kind of jobs they have. The people will move voluntarily. The people will move because they're sort of haphazardly, but they'll move.
Yes, economic migration has always been a factor in American life, and it may well reverse some of the urbanization that we've had for the last 25 years.
So that's it. I want to tie to the migration question or moving question to something that Stephen just brought up. But Marty, did you want to respond since we're still on the question you put out to the group?
No, I was going to talk about the funding issue that John brought up.
Go ahead.
Is that all right? On the one hand, and maybe David disagrees with this, I hope he does, but on the one hand, I'm always surprised by how few of the people who now develop and run affordable housing have health services within their buildings. There are a few who are great and who are providing a real leadership model, but I'm shocked at how many people are resistant to it because of the cost. So on the one hand, the private investment concerns me, but on the other hand, I think what we need is a model. And I think a model for funding comes from a partnership that's probably comprised of some foundation money from foundations that are concerned with this, health insurance companies, to whose advantage it is to have a health secure housing, maybe universities, some
Healthcare
private.
organizations have a ton of money exposed.
Pardon me, I'm sorry, Dave.
Healthcare organizations have a ton of money exposed,
Right.
primary care organizations.
So I think what's needed is a couple of organizations to put together partnerships that are successful. And then I think the money will follow.
Thanks. So we have several questions that have come up in the chat, and I'll put them all on the table and we can pick them up as you like. So the first one was a question from pre-COVID reaching into present, specifically related to commercial buildings. Why are there no operable windows and ventilation, and how does that impact health security when outside air is, as George has said, always cleaner than any mechanical system can achieve? So that's one question, a technical building question. Stephen has asked that health secure housing in its essence seems vulnerable. So what happens when that health security breaks? If someone gets sick, is the whole site now compromised? Are the vulnerable ejected or evicted or kicked out? How is that managed within a community? And then Cassius has raised the question of how we educate children and how is that going to affect our housing. We talked a little bit about the workplace shift and the implications of that and who carries the burden for that shift, both economically and in terms of physical space. Similar question along the lines of children who are now at home and learning from home, and how does that tie in? And we have about 5 minutes left until we reach 1 o'clock. People are welcome to leave at 1. We scheduled this for an hour. We can also run about 10-15 minutes or so of injury time if people want to keep discussing. We won't penalize you if you sign off. You're welcome to stay. And so the conversation keep going. I will say thank you now to everyone for joining us, and you can move as you need to for the rest of your day. This has been great. Really appreciate it. So 3 questions on the table. David, John, or anyone else, you're welcome to respond to the questions as well.
I'll do a very short one on vulnerability. As we envision health secure housing, it has a campus or internally divided set of areas so that you move within the campus without exiting from the community being the people that you live with in your health family. That requires a reconfiguration of the interior space for, let's say, high privacy versus low privacy. Maybe there's some negative air pressure rooms. Maybe there are other rooms with more intrusive, more active electronic monitoring and the like. That is inherently a more complicated use of the property than the dormitory slash hotel slash monastery dorter model of apartments that has dominated for 2,000 years. It's actually easy to do from a retrofit standpoint, but to go to John's point a while ago, operational and procedural aspects of it and informational aspects of it are a big deal. I want to connect it only to one other thing that Paul made reference to, because the infrastructure is discriminatory because it goes from not by race or anything else, but by money to poverty. And it is the function of government to be counter-cyclical with respect to a variety of things, including unacceptable human discrimination at the level of impact on people. The problem, Paul, is always how do you get the government to catch up fast enough, which is where the discussions about cities first, then states, then federales, and or, Marty, your point, there need to be some paradigms. So what we're trying to do in HSH is trying to find early adopters. That's why Shannon's offer of, hey, this is a case we're doing. Are you interested in the case? We're interested in every case, okay? Because every case is part of a learning process, and the reason fruit flies are still around is they evolve faster than we do. So we need to have intellectual. Yeah, we need to have intellectual fruit fly innovation as fast as we possibly can, including, as Cassius pointed out, the issue of education, which I'll let others talk about. But absolutely. And we have to enlist poor people in us. I guess, Paul, that's my ultimate point. If you don't see poor people as customers and counterparties and parts of the health security network, if you see them as passive recipients of a housing service or a health service or something else, you're guaranteed to fail. If I have one lesson globally, it's that you better figure out how to make the poor be and be felt to be the equal of the other stakeholders at the table, because otherwise you don't hear the truth. And if you don't hear the truth, no top-down solution will work. I will now climb down from my soapbox.
Good soapbox. Tough segue from that to office buildings, but it's pretty obvious answer to why office buildings other places aren't ventilated. It's because it's expensive to have fresh air, because you have to condition the fresh air if it's cold or if it's hot or if it's humid or it's not. Most of the thrust of Joe Allen in my book, Healthy Buildings, is around saying how short-sighted that is. Partly because until recently, we've been designing these glass boxes that use mechanical means to fight against what the sun wants to do, notably glass cubes in Abu Dhabi or somewhere like that. But secondarily, it's short-sighted to save a few pennies on electricity and stretch the fans a little more when the people are clearly not performing as well. So the thing that really caught my eye about Joe Allen's research at the Harvard School of Public Health was something called the COG-FX study, a cognitive function study, where they did double-blind research using volunteers and changed the level of particulates, CO2, and VOC, as well as organic compounds in their workspace over the course of a week or two, and did cognitive tests, and showed that each person did demonstrably worse in building in spaces that just had the normal level of CO2 we might see in a stuffy conference room, or when we first get on an airplane. You know how sleepy you are when you get in an airplane? Because they're not running the fans. So this is really short-sighted in buildings everywhere, saving a couple pennies on energy and the human beings not performing as well. That we think that is going to change anyway. I also would argue with the statement that the outdoors air is always cleaner, however. American building codes assume the outdoor is cleaner and talk about changes of fresh air. If you live for a long time in Shanghai or Delhi or Mexico City, you know that's not necessarily true. So when people are able to start having their own individual air quality monitors and looking at the building they're in, they're going to be looking at the level of ventilation and filtration that the landlords provide in these buildings, and those buildings that can provide that demonstrably cleaner air with the right humidity, the right particulates, will attract tenants more than others. We wrote a case study about 425 Park Avenue, which is a new building in New York by L&L Properties, and Norman Foster is the architect. They claim to be the healthiest building in New York because they're well building certified and have a lot of fresh air. The entire dilemma in the case is, okay, you spend all this money making it healthy. Will the tenants actually care? And will they only care in a premium building, in a premium location, in a premium city, or will other tenants care? So the jury is out on that. The indication so far in post-COVID time is that tenants, whether they're tenant companies or individuals, are going to care a lot. And to Marty's question, we don't know how long they're going to care for or how long they'll be able to pay for that. So that would be my answer on the office buildings. With respect to schools, Joe Allen has a piece in the Washington Post today about opening schools. He's a public health guy. He also has young kids, so he's really about getting the kids back in the school with the various guidelines to do. And they published a 60-page report from the School of Public Health about all the different things you can do. But essentially, there's no one size fits all. It's a hierarchy of controls. And the most effective control, but the most expensive, is to shut down the entire economy. Everybody stays home, social distancing. The next effective control in this pyramid, this hierarchy, is less effective, is to have essential workers go into work, but it's less expensive. The next is around interventions in the building, healthy buildings around fans, filtration, bleach, ultraviolet, all that kind of stuff. The next is administrative controls, which are around how far apart are we? Are we doing the surveys? Are we doing the screenings and the settings? And the last is personal protective equipment, the least effective, but also least expensive. So every school building has to select on that hierarchy of controls based on how much risk are they willing to bear, how much risk are they willing, do they want to dish off, and what are the conditions in their local community. So there's no such thing as zero risk. I mean, schools also have a risk of fire and earthquake and those things. The kids still go to school. So there's a question of balancing that level of risk, which is sort of outside my expertise, but you could read what my co-author wrote about it in the Post this morning.
Great, thanks, John. One more question came in as well. And Andrea, if you don't mind me putting you on the spot a little bit about your research, it's exactly what you've been looking at. So Monty has asked, how we think about engaging poor people in developing countries, emerging economies, on improving the impacts of housing on health. And Andrea has spent the last 6 weeks, 7 weeks now, looking at exactly these questions in the context of Latin America, and particularly informal settlements in Latin America. So do you mind if I put you on the spot to answer that?
Yeah, I don't know if I have the answer quite yet, but yes, that's some of the things that we've been looking at for the summer, is to try to think, what are some of the key issues that we should be considering as we try to expand the concept of health secure housing outside of the United States. And particularly, so I am from Argentina, and I have worked in the past with informal settlements in the city of Buenos Aires. So how can this concept be also expanded there with its very unique challenges that that territory sort of has. Yeah, just trying to define the different steps or the different areas that we should be protecting, and not only thinking in the context of informality, not just thinking in terms of housing, but also thinking in terms of community. How do we create safer communities where people can sort of like, yeah, just maintaining their networks and being able to have to continue with some of their social lives, but at the same time trying to keep a separation and to try to stop the spread of the disease at the times that it becomes more complicated. So yeah, and in terms of like international work, it's always important to think specifically of what is the territory that you're going to be working in, and they all have their own unique challenges, but at least what some of the thoughts that we've been having this summer indicates that it could be replicated in this Latin American context.
And I'll add to that a bit as well, Monty. I know you're very familiar with CARE and CARE's work. We've been having many of these discussions with CARE in the context of refugee housing, particularly in Jordan and somewhat in Lebanon as well, which had been a longstanding partnership that AHI has been building with CARE, but has taken on a deeper meaning and more intensive focus in the last several months, certainly around the health aspects of that. So there's a lot of different ways to think about it, not just in informal settlements and international context, but also in the context of migrant populations or refugee populations, where the house itself is almost inevitably not going to be safe for one reason or another. And how do we address that? Which will also, I'll make a pitch for the next webinar in the series, coming sometime in August, date to be determined, will be focused on this question of housing for refugees and migrants, and more stable interventions on that, both long-term, but then with a health element as well.
And let me add to that, the domestic analog of that. I don't exactly know what the number is, but let's just say it's 15 to 20 million informal, undocumented workers in the United States. All those people sleep somewhere, and very few of them are homeless. Most of the places that they sleep are in dwellings that were designed for a different kind of occupancy. This now starts to become visible when you see the very high COVID rates in Chelsea, for example, Chelsea, Massachusetts, because you've got a lot of people living in overcrowded and undocumented situations with undocumented landlords and cash wet economy transfers of money for the rental. So informality, there's a Roman version of this, faults in one, faults in all. If you're informal in your legal status in the country, you're almost certain to be informal in your employment, which means you're almost certainly going to be informal in your housing, which means it's very likely that your housing is not health secure, which means that you are much more likely to be a transmitter or spreader, both in the broader commute network and in the neighborhood that you're in. So our other intern for the summer, who may or may not choose to reveal herself after I've described her research, has been focusing on the relationship between the private space and the immediate neighborhood or public space. How do we make the abutter spaces healthy? What is the process by which a community or a group of people protects the health, security, or healthiness of the public spaces that are around them? Because while the air is not always fresh, George, every parent says to children at some point in time, will you please go outside and play in the fresh air, if only so I can think straight for a while. So how do we create So the concept becomes larger than just your health secure housing. It becomes your health secure street and your health secure neighborhood. And increasingly there's a people focus of that. Elizabeth, you want to add anything to that?
I mean, you described it so well, but my research has, like David said, it has a lot to do with how space is divided, and mostly my focus has been internal within what you could call an affordable housing campus, but specifically like the complex and the nearby spaces, the spaces within the property, or like highly accessible spaces for residents, and just looking at the division of space, because the public space as we know it has changed so much and is going to continue to change and evolve just based on what we know about COVID. And yeah, I think that's my brief bit.
And the only thing I would add to that is elderly people, particularly elderly people who are not living with an extended family, need to socialize with each other. They need to exercise with low impact exercise. They need signals and guides and nearby safe spaces that they can't get lost from. And they are among the highest risk and highest impact Horizon 1 and Horizon 2 interventions we can make. And so I'm really interested in applying that kind of thinking at the level of elderly complexes in a whole variety of contexts, including, by the way, virtual cognition. Sorry, John.
There's an interesting potential avoided cost component here too, because those undocumented people went to the emergency room and they were treated at Boston Medical Center or at Beth Israel or at Mass General.
And very high
for a
users.
long time.
Yeah,
Some of them
repeatedly.
per month. So somebody pays for that. That's the socialized cost also. And the city of Boston will pay that, or the PPP funds will help to reimburse Beth Israel, or Boston Medical Center will try and suck that up. And you could make the argument in the abstraction that the city or those hospitals would have been better off to pay for healthier spaces for those people, even if they're very densely populated, to have the elevators work and the ventilation work and the other physical features that Elizabeth is talking about done. And if this disease is going to stay with us and there isn't right away a vaccine, or you can get it twice, or you can get it worse the second time, that will start to look like a very good investment to have the public sector, or even the hospitals or the health insurers or the payors, say, what can we do to keep people from getting this horrible disease to begin with?
Yesterday on Boston NPR, Lyndia Downey of the Pine Street Inn was interviewed for 5 or 6 minutes, which in NPR terms is a long local interview, all around what Pine Street Inn had been doing. We've been in dialogue with the Pine Street Inn and with Boston Medical Center, because you do have people who in effect shuttle as between BMC and Pine Street Inn. The inn has taken over some city buildings in between the hospital and the Pine Street Inn and turned them into transition recovery dormitories. And Lyndia was quoting statistics of COVID positive rates in the homeless shelter, which were like 40%, dropping to 1.5% because of a little bit of a physical retrofit coupled with operational retrofits, coupled with, to go back to a point Marty was making, a partnership of necessity by two parties, the big hospital and the homeless shelter provider, and the third party, which is the city of Boston, which directly or indirectly is the reinsurer of all of this stuff.
Great. Well, on that note, I will release everyone, although this discussion is great and we want it to keep going. So thank you all for engaging in this discussion. I also want to thank everyone for engaging with AHI in the past in the many ways you have. We managed to do what we do and explore these new ideas because we have everyone's support, intellectual support, financial support, you name it, support. We welcome it all. We appreciate it all. And we hope you had some fun with this. So feel free again to follow up with David, with me, with John, on more ideas, more questions, and we will have another one of these discussions and webinars in about a month's time. So stay tuned.
Thank you, everybody. This has been great.